Hey everyone, I am Dr. Sneha Rathi and I welcome you to TimesHealth Plus. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute Santa Cruz. I amalgamate the merits of the modern physiotherapy techniques and yoga techniques and bring in results on my patients. Now, let's use this time to understand our bodies well, to connect with it, and to move with awareness, to find a pace wherein we are good and feel support in our everyday life. Let's now, in this session, we are going to understand our bodies, check into our bodies, and understand whether there are any areas of stiffness. Become aware if there are any weaker areas. And also understand that how posture and our movement habits can actually affect how we feel. Now, let's understand how to reconnect with our body and do it one mindful movement at a time. Before I proceed with this session, I would like to understand how many of you are suffering from any kind of joint pains or aches. If there is anybody who is suffering from any kind of joint stiffness or muscle related complaints, you can write it in the comment box. I can see that some people are having cervical issues. There are many people who suffer from low back pain. You might have experienced low back pain issues in your life. There is stiffness in the neck. I can see that. There are muscular pains. So all these activities actually can affect your daily life. There are activities like just getting your grocery from the shop, right? You might have experienced that you're unable to lift it when there is low back pain. Some people also suffer from cramps and pain in joints. So there are different kinds of muscular pains and aches which can actually limit your daily activities. We are here to understand how to tackle these muscular aches and pains by becoming more aware of our bodies, by becoming more aware of our movements and the areas which need attention. There is also someone who says that he has shoulder pain. So again, we are going to tackle all the joints that are coming in our way and try to understand how to deal with them. Shoulder pains can actually limit your way of overhead activities. For example, if you want to remove something from the top shelf, you might have experienced because of the shoulder pain, you are not able to lift it out comfortably, right? So now let's first dive into understanding our bodies into greater details. Thank you for sharing your aches and pains. I will be helping you to tackle all these in the coming sessions. Now, let's first understand that how joint pains, what is a joint actually? So, a joint is nothing but an articulation between two bones. I will give you an example. You have the thigh bone and the leg bone. It actually articulates at the knee joint. So, our knee is a joint. Similarly, we have the arm bone and the forearm bone. It articulates at the elbow. The elbow is a joint. So a joint is nothing but a connection between two bones, and it is surrounded by many soft tissue structures, like there are ligaments, there is a capsule which supports the joint. There are muscles which support the joint and help it move. So first, let's understand how movements take place at the joint. The joints have different shapes. The bones have different shapes. They articulate with each other, and depending upon the shape of the joint, the movements are decided. I'll give you an example of the shoulder joint. It is a ball and socket joint. So it moves in various directions. For example, it moves in the front. You can raise your arm up. You can take it back. You can raise your arm up from the side. You can take it towards your side, the side of the body and inside. And it also rotates. So these are the different movements of the shoulder joint. Now the elbow joint, it moves only in two directions. That is, it bends and extends. So it flexes and it extends. Then there is the wrist joint. It moves in four directions. You can move it upwards, you can move it downwards, and you can move it side to side. Then we have the hip joint. Just similar to the shoulder joint, you can move the hip in various directions. For example, you can move the hip up, you can move it behind, you can move it sideways, you can move it inside, and you can also rotate the hip. So now, the next movement is that the knee. The knee actually moves only in two directions, just like the elbow. It bends and it straightens. Then we have the ankle. The ankle moves in four directions. It can move up, it can move down, it can move side to side. And we have the spine. It can move in various directions. For example, you can bend forward, you can bend backwards, you can bend side to side, and you can also rotate. Say similarly, there are movements at the cervical spine. You can bend forward, you can bend backwards, you can turn your head, and you can bend side to side. So these are the various movements that happen at our joints. Once we have understood what are the movements that happen at our joint, when we are performing any kind of yogasan, we can actually assess those movements and become more aware where is the restriction and where is the weakness. So before we dive into understanding the yogasans, let's first understand what is joint stiffness. So a feeling of tightness around the joint or immobility, यानी you are not able to move the joint. आप अपने joint को move नहीं कर पा रहे हैं efficiently. That is nothing but joint stiffness. There could be various reasons for joint stiffness, like arthritis. There could be some underlying diseases like rheumatoid arthritis. It could be a simple muscle tightness. It could be age related. or it could also be due to lack of use of the joint. So it develops tightness or a sustained posture. आप एक पोजीशन में अगर कंटिन्यूअसली लंबे समय तक बैठ गए हैं, उसके बाद कभी-कभी नी का मूवमेंट करने में डिफिकल्टी होती है. That is nothing but joint stiffness. It could be due to swelling. Now, let's understand what are the signs and symptoms of a joint stiffness, of a stiff joint. So, I will give you an example. The first sign and symptom is restricted range of motion. For example, when you want to bend the knee, our knee is capable of bending up to about 140 degrees. That means our leg muscles touch our thigh muscles. But when we are unable to bend the knee so much and it only bends up to 90 degrees, it can be called as a stiff joint. Or for example, the shoulder. Our shoulder is capable of flexing to about 180 degrees. But if we are unable to bend the shoulder beyond 140 degrees, it indicates that we have a stiff shoulder. So this is about joint stiffness, and we are soon going to experience this in our body if there is any stiffness in the joints. The next is, let's understand what are weak spots in our body. So the muscles are responsible for bending any joint. For example, the biceps, it bends the elbow joint. If this muscle is unable to generate enough force, then we might not be able to bend the elbow completely. That is nothing but muscle weakness. I will give you another example of this. Like for example, if you are unable to lift anything out of an overhead cabinet, आपको कोई ऊपर से चीज उठानी है, but आप उठा नहीं पा रहे हैं. That could be because the shoulder is weak or the shoulder muscles are weak. So you are unable to lift something out of the cabinet. So this is nothing but it is muscle weakness. Now, there can be various causes of muscle weakness again. It could be nerve or muscle related directly. It could be simply lack of use of muscles. It could be due to any kind of medications. It could be due to age. So these are the different causes of a muscle weakness. Now, let's understand what are the signs and symptoms of a weak muscle. So there can be shivering or trembling when you are trying to lift the joint or the part because the muscle is weak. So you can actually feel that there is trembling. Another thing is you might do some trick movements. For example, when I'm bending the hip, I might tend to bend behind. This is also an example of a weak muscle. Because of the muscle weakness, you are trying to compensate by shifting behind. Another thing is that you might face difficulties with daily activities. For example, carrying a heavy weight. That can become difficult if the muscles are weak, and the muscles might get strained after carrying such a weight. Another example is that there can be pain in the joint. That also could be due to muscular imbalance or muscle weakness. So these are the different signs and symptoms of muscle weakness. I would like to add one more, wherein when you are standing on one leg, you are unable to maintain the balance. That also can be a sign of muscle weakness. So now, let me know if any of you have discovered these signs and symptoms in yourself anytime during your daily activities or during doing any kind of activities. What kind of signs and symptoms you have experienced, please let me know that too in the comment box. Muscular pains can occur. Mukesh ji says why muscular pains? Muscular pains can occur due to a variety of reasons. It could be simply due to muscle fatigue. That is, lactic acid accumulation can lead to muscle pain. It could be because the muscle is weak. You are unable to do the correct type of movement, and that can cause some impingement, or the joints may actually touch each other, and that can lead to pain. So there can be various reasons for muscular pains. There could be a simple electrolyte imbalance that can also lead to muscular pains and cramps. So there can be a variety of reasons why a person can experience muscle pain. Yes, Amitji says balance issue and trembling. That could be due to muscular weakness, especially of the legs. There can be balance issues and trembling. Manyaji says shoulder pain. Again, shoulder pain can be due to either shoulder stiffness or it could be weakness of the intrinsic muscles of the shoulder. That can be the reason why there is shoulder pain. So you have experienced how muscle weakness and joint stiffness can actually manifest in our bodies. Now, let's dive into how to identify these structures and how to identify these stiff areas and weak spots in our bodies while performing yogasans. And actually, yogasans can give you an insight into your own body and make you more aware of your body. And let me tell you, an aware body can deal with the problems in a very good extent and in a very good way. So, I would recommend all of you to please get your mats, and we will start with experiencing some of the yogasans together. And I will tell you where to focus on and to understand how these muscular weakness and joint stiffness can take place. Mukeshji says muscular pains take place due to exposure to fan. Sometimes cold air actually reduces the body temperature and that causes inflammation to increase. That can be a reason why there can be muscular pain due to cold air. I often feel, Arunavaji says, I often feel very tight when I wake up, and only that I always shift body weight in between two legs. So when you sleep, in the sleep, what happens is all the muscles relax. In the morning when you wake up, they are not ready to take up any kind of activity immediately. So you may have to do certain warm-up exercises inside the bed. Just some small movements inside the bed to relieve you of this tightness. If you suddenly start moving from that relaxed state, you might feel increased tension in your muscles. That could be one of the reasons why the muscles feel tight in the morning. So yeah, I hope everybody is ready with their mats. Now let's look into how to identify your stiff areas and muscularly weak areas. For that, I would recommend you to first start with conditioning practice. That is, we are going to stand in Sthit Prarthanasan and we are going to get all our attention towards our bodies. So, stand with your legs together. Join your hands in front of your chest and slowly gaze at one point in front of you. Now, I would request you to slowly close your eyes and bring all your attention towards your body and your breath. If there is any balance issue, you can keep your eyes open. Try to internalize your attention entirely towards the body. Now slowly open your eyes and relax your hands. We are going to start with practice of 4 asanas, wherein I'm going to ask you to focus on different joints of your body and you're going to experience Where exactly is the restriction? So we will take 1 foot distance between our feet. And slowly we are going to perform Talasana 2. In this asana, we are going to slowly raise up both our hands and come up on the toes. Focus on one point in front of you. Bring your hands down from the side and come back. Now, we are going to perform this asana with counts, and we are going to experience where exactly is the restriction. So try to observe your shoulders, try to observe your calves and your ankle, and try to notice if there is any difficulty or discomfort that you are experiencing. So we are going to perform it with counts. I'm going to give you 3 counts to go up, 6 counts to stay there, and 3 counts to come back. Start. Go up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly come back down. 1, 2, 3. Now, observe what happens while going into the pose, what happens when you are maintaining the pose, and what happens when you are coming out of the pose. Try to be aware of what exactly are the changes that are happening in your body. So let's repeat it again. Go up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly come back down. 1, 2, 3. Now we are going to try and do it with breathing. So let's start with by inhaling while going up, breathing normal while staying there, and exhaling while coming back. Inhale. 1, 2, 3. Breathe normal. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So experience the different changes that are happening in your body while doing this asana. Now let's go on to the next asana, that is Konasana 2. Keep a 2 foot distance. Take one hand up and slowly bend sideways. Do not push your waist to the other side. Try to keep the waist in the center. Take your hand down, back to the starting position. We are going to repeat this on the other side. Bend sideways. Come back to the center and take your hand down. Now, what I want you to observe in this is what is the movement that is happening at the spine, and observe your shoulder. Let me know in the comment box what exactly are you experiencing while doing this asana. So let's start again with the counts. Take your hand up. 1, 2, 3. Bend sideways. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back. 1, 2, 3. We'll do it on the other side. Take your hand up. 1, 2, 3. Bend sideways. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back to the starting position. 1, 2, 3. So you might experience stretches or, some movement in the spine, or maybe sometimes pain as well while doing this asana. You can put it in the comment box later. That's fine, absolutely. So we'll do it again. Take your hand up. Now inhaling, bend sideways. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhaling, come back down. 1, 2, 3. While you are into the pose, make sure you're breathing normal. We will do it on the other side. Inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. So I hope you have experienced certain stretches in different muscles in the joint and the movements at the joint. Now let's go on to the next asana, that is Veerbhadrasana 2. Here, we will keep a distance of about 3.5 to 4 feet. Turn the foot outside. Turn right foot outside. Now, take your hands at the shoulder level. Slowly, you're going to bend the right leg at the knee and turn the head towards the right hand. Stay there. And now, slowly come back to the starting position and take your hands down. We will repeat it on the other side. Turn your left foot outside 90 degrees. Take both your hands up. Slowly bend at the knee and turn your head towards the left hand. Stay there and come back to the starting position. So here, what all you're going to observe is observe your shoulders, observe your hip when you turn it outside. Are you able to turn it outside completely? Observe your knee. How much are you able to bend the knee? And observe your neck when you're going to turn the neck towards one side. So let's repeat this asana again with counts. Take your right leg outside. Take your hands up. 1, 2, 3. Now slowly bend your knee and turn your head. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back to the starting position. 1, 2, 3. And relax. We will repeat it on the other side. Turn your foot outside. Take your hands up. 1, 2, 3. Go to one side. Bend your knee. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. And slowly come back. 1, 2, 3. And relax. Now let's do it with the breathing rhythm and keep observing your body as well. Turn your foot outside. Inhale, take your hands up. 1, 2, 3. Exhaling, go down. 1, 2, 3. Stay there. Normal breathing. 2, 3, 4, 5, 6. Slowly come back. 1, 2, 3. And relax. Do it on the other side. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale and come back again. 1, 2, 3. Exhale. 1, 2, 3. So, I hope you have observed the different joints that I have mentioned to you. Now, let's go on to Gomukhasana, variation in standing. Over here, what we are going to do is we are going to test our shoulder flexibility. So, we are going to raise the hand up and slowly bend the elbow. Take the other hand behind and try to interlock our fingers behind. If you are unable to do that, it's okay to reach till where you are reaching and stay there. So let's perform this asana. Inhaling, take your hands up. 1, 2, 3. Stay there with normal breathing. 2, 3, 4, 5, 6. Exhaling, take your hands down. 1, 2, 3. Now do it on the other side. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhaling, release. 1, 2, 3. We are going to repeat this one more time. Inhale, 1, 2, 3. Stay there with normal breathing. 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Repeat it on the other side. 1, 2, 3. Stay there with normal breathing. 2, 3, 4, 5, 6. Exhale, 1, 2, 3. So with this asana, we have tested the shoulder and the elbow flexibility. Now let me know in the comments, which all asanas did you feel that there was some restriction or there was some weakness in the muscles and you felt some difficulty while doing the asana. Also write down what was the difficulty that you were facing while performing the asana. You can also practice these 4 asanas later and also experience it once again when you have the time, and put it across in the chat comment box and let me know if there was any difficulty or discomfort. Amit ji says, last one Gomuk, it happened only on one side. So yes, this is very common that there is restriction in one of the shoulders and that causes Gomukhasan to be affected on one side and it is normal on the other side. This is a very common condition and it can be worked on gradually while working on the shoulder flexibility. But you have come to know that it is affected on one side. That is the body awareness that I am talking about. First one's name is Talasan 2. Anil ji says, I felt pain in the shoulder. So sometimes, which was the asana that gave you pain? You can let me know. Jagdeep ji says, in the last exercise, lower right arm doesn't reach up. So when there is restriction in the movement of the shoulder, like the internal rotation is restricted, sometimes the lower arm, it does not reach behind the back right up. It's okay to do that. You can reach up to the level it reaches and you can slowly try and use a towel or something to grab and do the movement. Arunava ji says, my right hand can't hold the left hand at Gomukhasan for one accident long back. I can even feel a humped muscle on my right shoulder in normal standing. That's a very good observation. I must say that he has been able to figure out what exactly is the position of his shoulder, and this can be a very good thing to be worked upon eventually. So let's move on to the next thing for the day. The next thing is about posture. Let's understand that starting position is very important before you attempt any yogasana. Once we have become aware of how to assess our bodies while performing yogasanas, now we need to understand that from the position you start the yogasana, it is very important to understand how to be in a good posture before starting any kind of yogasana. So I'm going to take you step by step to understand how your asanas can become better and whatever difficulties you're facing, for example, unable to reach the back with the Gomukhasana, you can actually work on it. So first and foremost is understanding the starting position. Now let's understand how should we stand correctly. So we can all do it together. We will be starting by focusing on our feet. I would ask you to slowly shift your weight towards the toes. Shift your weight towards the heels. And now try to bring it towards the center or the midpoint, wherein the weight is equally distributed between the toes and the heels. This is the right position for the foot. Many people stand more towards the toes or stand more towards the heels. This can actually alter the posture almost over till the head level, till the cervical level, till the head level. It can actually alter the posture. So we need to find the correct midpoint. So we are going to shift the weight towards the toes. Feel the weight towards the toes. Now shift the weight towards the heels. And now try to bring it at the midpoint. This is the correct standing posture for the foot. Now observe whether you have pushed your knees too far behind or you have flexed your knees. Try to bring it in the center. This is the correct position for the knees. Now observe your pelvis. If you have pushed your pelvis too far forward or you have pushed it too far behind, try to bring it in the center. So push it forward, take it behind. Now try to get it in the center and maintain the position. Now observe whether you have stooped your shoulders forward or extended your shoulders behind. Try to find a middle position. Do these movements and try to see whether you can find the midpoint. So stoop your shoulders forward, extend them behind as much as possible, and now try to find a middle position. Now observe your chin level. Whether you are looking upwards or you're looking downwards, look straight and see to it that the chin is parallel to the ground. Now, see whether you have poked your chin forward, whether your ears are ahead of your shoulders, or you have taken your chin up. Try to bring it to the neutral position. Keep your gaze in front of you. Try to keep your chin parallel to the ground and try to tuck in your chin slightly. And the last but not the least is stand tall. Push your head upwards and try to stand tall. Do not relax your body into a forward stooped or sagged posture. Try to stand as tall as possible. So this is the correct standing posture. Practice this gradually. You can practice it in front of a mirror. That will be really helpful to you for correcting the posture. You can slowly turn your head and try to see whether you are aligned properly. The next one is the sitting posture. So we are going to go and get a chair. And sit on it. Nowadays, because of the desk jobs, there are a lot of posture difficulties in sitting. So we're going to see to it that we are not sitting on the tailbone first. That is the most important thing. We are not sitting too much pushed behind, but we are sitting adequately on our sitting bones. And our belt level touches the back of the chair. The next thing that I want you to notice is the foot. The foot should not be dangling down, or it should not be lifted up on some surface. It should be at 90 degrees with the ground. The next thing that I want you to notice is the knees. The knees should not be at a lower level than the hip. They should be at the 90 degrees with the hip. The next thing that I want you to notice is the seat of the chair. It should not be touching the back of the knees, but it should be supporting the thigh properly. The next thing that I want you to notice is you're not stooping forward from the spine. You're sitting up straight and tall again. and your gaze is in front of you. Again, observe whether your ears are on the shoulders or whether it is poking forward. Try to bring your chin in such a way that your ears are on top of the shoulders. So this is about the sitting posture. When we start any yogasana from the correct posture, we are going to have the benefits of that pose in a much better way than we start the yogasana from a wrong posture. So it is very important to be mindful about your postures and to regularly check whether you are standing and sitting in the correct posture. So I hope you have understood the different points that I have mentioned to you about having a good posture. Do not worry, we are going to delve into more details of a correct posture in the upcoming sessions. Now, once you have ascertained the starting position and the posture, it is very important that you start your yogasana practice with a good warm-up. Why is warm-up important? For example, when I am performing Hast Padangusthasana, I'm going to straighten my leg. It gives an intense stretch to the hamstring muscles. There can be a risk of injury if you do not start with a good warm-up. So it is very important that you make sure that you perform a warm-up, like it could be simply raising the leg up and stretching the hamstrings little before you start with any kind of the asana. Now, what does warm-up do? It actually increases the temperature of the body a little and improves the flexibility of the muscles. It also helps in improving your overall performance of yogasana. So, as I'm taking you step by step on to how to perform good yoga postures, let's perform some of the warm-up exercises today. So, the first exercise, we are going to stand with the 1 foot distance. And while performing warm-up, I also want you to observe your body again for any restrictions of movement or any weakness that you're feeling. Do it with full concentration on your body. So we are going to first do a head up and down position. So we're going to look up as much as possible and look down. Try to touch the chin to the chest. Look straight. Again, look up and look down. And straighten. We'll do it once again. Look up and look down and look straight again. The next exercise, warm-up exercise that we are going to do is rotation of the head. So you turn it towards the right side and towards the left side. Observe if there is any restriction of movement. Again, turn it towards the right and towards the left and center. Once again, right, left, and center. The next exercise that we are going to do is try to drop our ear to the shoulder. So drop the ear to the shoulder, bring it to the center. Keep gazing at one point in front of you, ear towards the shoulder, and bring it towards the center. Repeat it again. Center, other side, center. Once again, right side, center, left side, center. Now the next exercise that we're going to do is for the shoulders. So you're going to keep your hands on the shoulders, touch the elbow, try to touch the elbow in front of you, and slowly rotate the shoulder from front, up, side, back. Again, front, up, side, back. Repeat it again, front, up, side, back. This will also help you to open up your shoulders and make your Gomukhasana better. front, up, side, and back. So this is the next exercise. Next we are going to do is the wrist. So keep your hands at the shoulder level and try to slowly take the wrist up and down. See to it, how much are you able to bend the wrist? Normally, up it can go up to 90 degrees and down it can go up to 80 degrees. See to it whether you are able to do the complete movement. So take it up and down, up and down, up and down. The next movement that we are going to do is the spine rotation. So join your hands in front of you, clench your fingers, and slowly turn towards the right side. Come back to the center, turn towards the left side. Come back to the center. Again, turn towards the right side, center, left side, center. Once again, right side, center, left side, center. Try not to turn from your legs, but more from your spine. Right, center, left, center, and relax. The next is for the hip. So bend your elbows to 90 degrees and take the hip up. 1, 2, 3, 4, and 5. Do not try to take your hands down and hit the hip like that, but keep your hands at 90 degrees and try to bring the hip up as much as possible. If it is not possible, it's okay. You can go slow and steady and try to achieve it gradually. The next thing is for the ankles. So we're going to take both the hands here, or you can take support of a wall if you're unable to balance on one leg, and slowly rotate the ankle clockwise. 3, 4, 5. And anti-clockwise. 1, 2, 3, 4, 5. Do it on the other side. Stand on one leg. You can take the support of the wall. 1, 2, 3, 4, 5. Do it on the other anti-clockwise. 1, 2, 3, 4, 5. So these are some of the warm-up exercises that I would like to tell you. And I would like to give you a task for the week that is called as the Mobility Minute Monday. Perform all of these warm-up exercises that we did today, again on Monday. So this is about the task for the week. And we have a small challenge for you. What we practiced just before this, the posture fix. It's called My Posture Fix. So you're going to take the picture of your posture before and after correcting and upload it on Instagram and tag TimesHealth Plus. So this can be one of the challenge for you, and I hope you will do it and remember all the posture points that I have told you. If there are any questions, you can please write it on the comment box. Chandanji asks, any asana for frozen shoulder? There are many asanas for the frozen shoulder. For example, you can do Yashtikasana. You can do simple shoulder warm-up exercises that we just did. You can do Konasana that we did today. Bending sideways, Konasana 2. All this will help in frozen shoulder. Please let me know if there are any other questions in the comment box. Any exercise, Pallaviji asks, any exercise for shoulder plates? I did not understand shoulder plates. What does it mean? If you could please elaborate it a little more. Is it shoulder blades? Okay. Yes, there are many exercises for shoulder blades. For example, you can keep your hands at the shoulder level and slowly take it behind, trying to squeeze the shoulder blades and bring it back in front. Take it behind, bring it back in front. This is one of the exercise. Another exercise is you can elevate your shoulders, take it behind and back, take it behind and back. So this is another exercise. You can also do it anti-clockwise. Take it from the front and back, front and back. So this you can perform for the shoulder blade. Yes, if there are any other questions, please let me know. Anilji says, how to get rid of long-term neck pain. My known is facing this issue since a longer time. So it's very important that you start first by correcting the posture. The points that I have told you about the posture, it's very important that you start correcting if there are any postural mistakes that are present. You may also look into the mirror and see whether you are tilted towards one side and try to correct the posture in this plane as well. And the one that I have told you about, the chin, poking chin, you can actually correct the posture. First, work on correcting the posture. Then start with a little bit of a warm-up exercise and try to observe where exactly are the restrictions and what movements are a little difficult for you. Gradually try to push into the restriction very slowly and with complete comfort. Do not push too far and too hard. Try to gradually push into the restrictions and try to do the warm-up exercises. Okay, so this is how you can slowly try and target the cervical pain that you're facing, and that will really help you with the neck pain issues. How to eliminate, Jagdeep ji asked how to eliminate a shoulder hunched posture. It is very important for you, as I have already mentioned in the postural points, it is very important for you to push yourself and stand tall. A hunched posture occurs because of constantly looking down into the phones or into the laptops or constantly trying to, bend and closing this epigastric area. So make sure that whenever you are sitting, this epigastric area is open and it's not closed like that. So it's very important that you do not sit with this closed epigastric area, but an open one, and try to sit tall. Push your head up and try to sit tall. There are a few exercises that we are going to discuss in the next session for the same. So make sure that you attend that session and you will be able to understand how hunched posture can be corrected. Pallaviji asks, do we have this session every Sunday? Yes. Thank you, Jagdeep ji, for your amazing comment. Thank you, Anil ji. Saraswati ji asks, knee ligament, mild tear, and pre-osteoarthritis. What to do and what not to do. We would be coming with this session eventually when we are targeting the knee and ankle joints. So we are going to cover each and every joint in these sessions. So you may attend those sessions and I will be able to answer all of these questions in each session. But you can do some simple knee exercises definitely. So we are going to cover that in the upcoming sessions. Are there any more questions? Please feel free to ask. Amit ji says, looking forward to your session of the knee. Yes, definitely. So that's it for today. Okay, there is one question. Shevaji asked, any suggestion for cervical radiculopathy cases? So cervical radiculopathy actually can occur due to a number of reasons. It could be disc related. That means the disc is protruding out and that is compressing the nerve and that is causing pain in the arm. It could be due to some kind of degenerative changes. That is, the space between the vertebrae has reduced and that is causing the compression of the nerve. I would recommend you to first and foremost, again, important thing is correct your posture. That is the most important thing because generally cervical radiculopathy there is altered cervical, the shape of the cervical spine is altered. So make sure that you become aware of your posture and correct your posture. That's the first thing that you need to do. Another thing is that for cervical radiculopathy, definitely physiotherapy needs to be done, because the cause of the root cause needs to be solved, whether it is disc related or it is related to the degenerative condition. So it is very important that you get physiotherapy done for the same and correct your posture as per the points that I have suggested. Any other questions, please? I will be glad to answer. Saraswati ji asked physiotherapy or yoga, which is better? So both are good, and they are sciences that have been established over years of time. It all depends upon what condition are you suffering from and what stage are you in. If you are in the stage of severe condition, or it is involving a lot of structures of your joints, then you need to go for physiotherapy. Otherwise, you can definitely go for yoga when you are in the mild state, and you can actually correct your postures, you can become more aware of your body and tackle all the conditions that are there before even they start. So prevention is better than cure, is what yoga does. So you become aware from the points that I have told today. You become aware of your body, understand where are the stiff areas, understand which are the weak areas, and try to address them in the initial stage itself. That can actually prevent any kind of problems from worsening, and it can actually prevent problems from setting in the first place itself. So practice yoga regularly, become more mindful. That will really help you avoid many of the conditions that you need physiotherapy for. Thank you, Manya ji. So we have 5 minutes more. If there are any further questions, you can ask me. Shaivaji asks, ma'am, tendinitis in 33 years women, is it common or due to overuse of muscles during stretching? So it all depends upon what is the occupation, what kind of stretching does the person do on a regular basis, whether the muscles are getting overused, whether the muscles are weak and then getting overused. It all depends upon what is the cause. So we need to find out the occupation of the person. We need to find out whether the muscles are weak. We need to find out whether the person is overstretching, or what way is he stretching the muscles, or what way is he or she exercising the muscles. That will tell us that what is the reason for the same, and then we can address that tendinitis issue. Saraswati ji, thank you so much. So I think there are no further questions. So that is it for today. Thank you for connecting with your bodies again. Thank you for taking care of yourself. And while you go about the week, make sure you do the weekly tasks that I have given you. That is performing the warm-up exercises again on Monday, Mobility Minute Monday. And also make sure that you participate in the challenge, My Posture Fix, that is given to you. And I hope I have been able to add on to your knowledge of becoming more aware of your body. Until then, stay present, move gently, and make sure you take care of yourself. Thank you and namaste.